All righty, want to welcome everybody. Today's November 2nd. This is the Makah EOC public briefing. We'll go ahead and get our briefing started with Dr. Cope's report.
Absolutely. Good morning. And here's my slides. Just a second. Okay, here we go. Good morning, everyone. Welcome to November. This is the health officer update for November 2nd. We've, I think Chief Bruner will talk about this, but we've decreased our EOC briefings to once a month. So we haven't given an update in a couple of weeks, and happy to share some relatively good news. So first we'll start with our current active cases. So we have had a little bit of an uptick here in Neah Bay. So that is not great, but they are all medically stable and being managed at home, which is certainly something we're thankful for. We have had 142 cases total. We have 8 households in quarantine, so that number has gone down, and 14 individuals who are in the same household with someone who has tested positive. That number has actually, I know, gone down. So but we are not seeing as much transmission throughout households as we were seeing previously. So here you can see the spike that we had in September decreased almost immediately in October. And these 4 cases are the ones we had yesterday in November. So that is high for one day in November. And we'll certainly be monitoring the situation as we head into the next couple of weeks. We have had just about even numbers amongst the younger age groups of cases. So the last 2 weeks, we've had 14 cases. None of those cases have been in the ages 50 and over age groups. So somewhat evenly spread. In the last 2 weeks, 3 of those cases were breakthrough cases in individuals who have been fully vaccinated. A majority of those cases were in individuals who've received no COVID vaccine. And a small minority of those cases were in an individual who had been partially vaccinated. This is just a different graph showing where we're at with the vaccine rates here in Neah Bay. So just if the whole pie or the whole circle is all residents in Neah Bay who are 12 and up. So of those, 87% have been fully vaccinated, which is remarkable and such a great job. And I think, you know, as we head into the pediatric dosing, we'll see how that impacts the percentage, because this is just 12 and up, but that is something that is just really great to see. 4% have been partially vaccinated, so they've initiated getting at least 1 dose, and then 9%, which translates to approximately 115 people who are 12 and up, have not received any COVID vaccine. That does not, I do want to be very clear that because this is just ages 12 and up, this does not translate to herd immunity, because we have a large number of kiddos who are under 12. So when we include those numbers, it drops down to around 60, 63, 64% of our population that's been vaccinated. So Clallam County has also seen a decrease in cases. Their percent positivity is 7.44%, which is a relief to be down from where it was at around 21% earlier this fall. So it's still considered high risk, certainly a very high risk to socialize with individuals who you don't know their vaccine status or who they've been socializing with in the Clallam County area. And then they also, hospitalizations, they're still high. The healthcare system is still experiencing quite a bit of overload, but they have gone down. And this just visually represents that. You can see at the tail end how the cases have decreased at the end of October. Washington State is plateauing quite a bit higher than Clallam County has. So it'll be very interesting to watch over the next couple of weeks and months if Washington State continues to decrease or goes just right back up from here. We are anticipating a 6th wave to happen as a result of the holidays. So certainly as a health system, we're preparing for that, but unsure where that wave is going to stand compared to the last wave that we had. And here's just the data for the whole United States. As you can see, there's plateauing happening there as well, and it's plateauing higher than it has ever plateaued before when you look at these other dips. Moving on to vaccine news. So I'm going to talk about the pediatric doses first, and then I'll talk a little bit more about boosters. So last week, Pfizer did authorize an emergency authorization for the pediatric version of Pfizer's vaccine. The next step is CDC's ACIP committee. It's supposed to meet today. So today or tomorrow, we should get the final authorization or approval. STIC has this vaccine on order, and it will be shipped as soon as final authorization and approval is complete. So depending on when STIC receives these vaccines, we will host another large walkthrough vaccine clinic, similar to how we've done with the previous rollouts of the vaccine. We can't give a specific date and time yet, just because we literally do not know when we will receive them. The soonest it would be next week, most likely Tuesday or later. It'll be at the community gym, and it'll be open to all residents of Neah Bay who are ages 5 to 11. And we've also included numbers for the students at Column Bay schools. The pediatric vaccine for this age group is a very specific dose, and it's actually a completely different, not completely different, it's the same type or category of product, but it's not just a smaller dose of the adult vaccine. So I just want to be very clear that the trials have all been done on this vaccine that's very specific for this age group. It works the same, the mechanism is the same, but this product is different, and we can't just use smaller doses of the Pfizer that we have on hand. It was approved because it's been shown to be effective, very effective, and in fact for this age group has been more safe than any of the other clinical trials done on any of the other age groups. So there's been no serious side effects, including no anaphylaxis and no, absolutely no deaths or anything related to this vaccine. So that is why certainly trials have taken a lot longer and have been just more thorough, of course, because we're certainly concerned about effects of safety on this age group. So that's all I've got in terms of the update of the pediatric dose. Please look for announcements about any media or events where parents can ask questions. We did a little interview with Dr. Eastburn and one of our other providers. We'll be sharing that video probably earlier this week or a little later this week. But there are also events happening elsewhere, and you can certainly call our providers and ask questions about your own kids if it's safe for them to get the vaccine. Okay, moving on to the boosters. So the new news is that all members of a tribal or Indian community who are 18 and older are eligible for the COVID booster vaccines. So we've received notice from the American Indian Health Commission, who reached out to CDC, that confirmed that this is in fact true. So all members of our community who are 18 and older are eligible for the COVID booster vaccines. To help with some of the confusion around, which vaccine you received or what you should get in the future, I tried to break it down into the two groups. So if you received Pfizer or Moderna, you're eligible if you're a member of the community here and are 18 and older. For non-tribal members, we break it down to 65 years and older, or 18 and older if you live or work in high-risk settings. Certainly a conversation with your provider is worth having if you don't quite fit any of these age groups or you just have questions. When to get the booster should be at least 6 months after your second shot. It will be earlier if what you're doing is more of a third dose because you're severely immune compromised. But for the general public without any immune compromised status, you'd want to wait 6 months after your second shot. And then which booster should you get? You can choose which anyone you want. The CDC isn't making a recommendation. Our providers here certainly all agree that Moderna would be the best choice for a booster just based on the data showing effectiveness. For those who've received the J&J or Johnson & Johnson, also eligible if they're 18 years and older. And then they are recommending the booster vaccine 2 months after your shot. And that's because the J&J has just been repeatedly less effective. And so you need that booster a little sooner. Again, any of the COVID vaccines that are authorized could be used in that population. We would certainly recommend, again, Moderna, especially for those who just received the Johnson & Johnson previously. So following that, we are having another large vaccine clinic this Thursday. It'll be both COVID and flu vaccines, and you can do both at the same time. It'll be from 12 to 4 at the community gym. Flu vaccines are for anyone 6 months and up, and then the COVID vaccines and boosters for those age groups mentioned. So initial vaccines for COVID can be 12 and up, and then boosters for anyone 18 and older. And again, you can do both at the same time. And just a quick reminder that STIC is open. If you need medical attention or have questions, need to follow up on chronic disease, etc., please just call to make an appointment. Masks are required at all times in the buildings, except as necessary in order to get that treatment that you're coming in for. We are doing a COVID test for anyone who's unvaccinated prior to coming into the medical clinic. Vaccinated individuals do not need to be tested unless they have symptoms or a concern about exposure to COVID, or that's the reason that they're coming. We are working on possibly opening the waiting room, and there will be a screener and COVID testing again prior to entering. This plan may change if COVID conditions change. So we're really just kind of monitoring a couple of metrics. And then also, I think is well known, we've got a lot of COVID supplies, PPE, COVID testing, et cetera, that are currently stored in that waiting room. And we're working on relocating those to other storage areas. And we will keep an option for patients to wait in their cars or outside. That is certainly the safest option during the pandemic, and patients will be able to choose to do that if they want, even when we open the waiting room. Lastly, we have mammograms today, not COVID related, but I just wanted to mention that because we have some walk-in slots. So walk-ins are welcome. Mammograms are recommended annually for women ages 40 to 74, and for women who are younger than 40 with a family history of breast cancer. And then also for men who have the genetic risk for breast cancer, the BRCA gene. All right. That's it for me. So it's a bit of a long update, but thank you everyone for your attention.
All right, thank you, Dr. Copes. A lot of information, a lot of new information, so thank you for that. Please pass on the thanks to all the staff and let them know we appreciate all the work they're doing and the work that you're doing. So Patty, we'll move into the tribal organization update.
Okay. So I am happy to announce on behalf of the Tribal Council that they are offering a vaccine incentive of $1,000. And it's for those living on the reservation or employed by the tribe. So in order to be eligible for this, you have to be an enrolled member residing on the reservation, enrolled members living off the reservation but are employed by the tribe, or non-tribal members who are employed by the tribe. So in order to receive this incentive payment, you need to provide your proof of vaccination, either from the Sophie Tredevick Health Clinic or whatever medical facility you may have obtained it from. And our payment process, if you provide your proof to April, she will gather them all up and will process them with finance on a weekly basis. If you're an employee, your card is more than likely already on file in Human Resources, so you don't need to submit it again. We're going to process payments every Wednesday and send them out in the mail the same day. If you are already set up for an electronic payment with the tribe, that is how you'll receive this payment. However, no new electronic payment accounts will be set up. So this will be open until December 13th, 2021, which is a Monday, and the last payment will be issued by December 15th, 2021. If anyone has any updated information, such as their mailing address, etc., if you could please provide that information with April. And any questions, you can call Rose Taylor or myself. The other thing we have going right now is we're going to be putting out a bid for the 2 tiny homes to get finalized with water and sewer and skirting and porch and stairs. So hopefully we'll get some people in there before the holidays. And that's it.
All right. Well, thank you, Patty. Appreciate the update. It's good information. Glad to see those projects moving forward and getting completed. And thank you for all the information. As far as the Makah EOC, I just wanted to remind everybody that we are having the public briefings monthly now. We will put the date out next time. So we're making a transition from a weekly update to the monthly. So we're sorry about the notice that didn't go out to everybody today. The only updates I have is please slow down for the checkpoints. The roads up there aren't the best of conditions. They're starting to have potholes and stuff in the area as you're leaving. So please slow down. It's high traffic area. There is pedestrians out there, which is our staff and possibly other staff in the area working. So please slow down when you're leaving a reservation and be prepared to make contact with the checkpoint staff upon your return for the car count of people in the vehicles. Want to remind everybody, please sign up for the regroup emergency messaging through the stick.org website. And today's meeting will be posted on the stick.org website later, so you can review it, put out the notice to everybody. Looks like our next meeting, public EOC briefing, will be 12/7, same time that we normally handle it at. So I believe that's all the updates we have for today. So we will close it out. I want to let everybody know, thank you for everything you do within the community. Keep working, keep staying safe, protect yourselves. I wanted to thank the Makah EOC staff, also the stick staff and EOC and Makah Tribal Council. So thank you guys and have a great day, and we will be talking with you next month. Thank you.
Thank you.